You ever hear your dentist use the term restorative work and kind of nod along, but you're not totally sure what it means? Well, in this explainer, we're going to break it all down. Using some great info from the Las Vegas Dental Group, we're going to see how dentists rebuild smiles from the inside out, focusing on making them healthy and strong, not just pretty.
Okay, so let's jump right in. This phrase, restoring your smile, you hear it a lot, but what is it really? Getting this part right is, honestly, the key to understanding everything else.
So you've probably heard the term, but it's super easy to get it mixed up with its more, let's say, glamorous cousin, cosmetic dentistry. So let's draw a really clear line between the two.
And here it is, the core idea. While, yeah, restorative work can definitely make your smile look great, that's more of a happy side effect. The real mission here is to make sure your teeth are healthy, strong, and working the way they're supposed to, for chewing, for talking, for your overall health long-term.
I love this comparison because it just clicks. Think of your smile like a house. Restorative dentistry, that's your foundation, your framing. It has to be solid, right? Then you can think about cosmetic dentistry, which is like the paint and the decorations. You just can't have one without the other. You absolutely need that solid foundation first.
So okay, we've got it. It's about the foundation, not just how it looks on the outside. But why does that matter so much? Why is that such a big deal? Let's get into the real-world benefits of putting health first.
I mean, look at this. This goes so much deeper than just appearances. We're talking about strengthening a weak tooth before it breaks. We're talking about getting back your ability to eat all the foods you love without thinking twice. And it's also about heading off huge problems down the line. It can even help preserve the shape of your face by preventing bone loss. This isn't just fixing things. This is proactive healthcare for sure.
So, the big question is, how do dentists pull all this off? Well, it's not like there's one magic wand. They have this incredible, specialized toolkit, and each tool is designed to solve a very specific problem.
And here it is. This is a great overview of that toolkit. The range here is just amazing. You've got something like a dental crown, which can save a cracked tooth and stop you from needing an extraction later. And then on the other end of the spectrum, you have something like a dental implant, which can replace a tooth you lost years ago and actually rebuild the bone around it. Each one has a very specific job. You can really think of crowns and bridges as the workhorses of restorative dentistry. A crown? It's like a custom-fit helmet for a weak tooth, giving it strength and protection. A bridge does exactly what it sounds like. It spans the gap from a missing tooth, which brings your bite back to normal and stops the other teeth from shifting around.
Now, implants. These are a whole different level. This is pretty amazing stuff, actually. Instead of just sitting on your gums, an implant literally fuses with your jawbone. Not only does this create an unbelievably strong and permanent new tooth, but it also stimulates the jawbone, which helps prevent it from shrinking away over time. It's a real game changer.
Ah, the dreaded root canal, right? I know it has a scary reputation, but when you actually break it down, it's a really logical, straightforward process. Think of it as a rescue mission for your tooth. The whole goal is just to get the infection out from the inside, clean everything up, and then seal it off to save your natural tooth from being pulled.
Okay, so this is where the lines get a little blurry between restorative and cosmetic. Procedures like bonding or veneers, yeah, they're often used to make a smile look perfect, but they also have a restorative job to do. They fix minor damage like chips and small cracks, which actually makes the tooth stronger.
But you know, having all these incredible tools is one thing. How they're actually used and the philosophy behind the care, well, that's what really matters. It's all about the approach.
And this right here is such a huge deal. It's a fundamental shift in dentistry. It's not a one-size-fits-all situation anymore. The modern approach is about creating a plan that is 100% tailored to your mouth, using the latest tech to get better and more comfortable results, and, this is a big one, making sure that you understand what's happening and are a partner in your own healthcare.
All right, so we've covered a lot. The what's, the whys, and the hows. So after all that, what's the one big idea you should walk away with?
And really, it all boils down to this. Restorative dentistry is an investment in your future self. It's not just about patching a problem today. It's about strengthening the whole structure to prevent a bigger, more painful, and more expensive problem tomorrow. It's that simple.
And that kind of leaves us with one final thought. You know, the first step toward a healthier smile, it doesn't actually happen in the dentist chair. It happens in your head. It's about understanding your options, prioritizing the health and function of your teeth. That's how you start building a strong, confident smile that's really built to last a lifetime.